to the EMA Tasking training. In this training, we are going to learn how to send messages over to the clinic staff. EMA is the electronic medical record tool used by finite clinics and employees to manage patient care and records. In this training, we will be learning how to send messages, also known as tasks, to the clinic staff. There's several reasons why you may send a message or a task over to the clinic. As an example, a patient may be calling because they need a refill on a certain medication. Or as another example, a patient may be calling because they need to know what their post-operative instructions will be. These are reasons, among others, that you will send a message over to the clinic. Remember to look the patient up starting off by using their date of birth. If you look in the top right-hand corner on the patient ribbon, you'll see a button that says Create Task. Click on that button. This is going to pull up the task fields. It's basically like a message or email type situation that you're going to be using to send over the request to the clinic staff. The first field that we're going to worry about is the task field. This is your overarching subject. When you click on it, there's going to give you a drop down with several different options to choose from. In this example, we're going to be sending a medication refill request over to the clinic staff. So we're going to click Prescribe. This next field for task details is like a subject line for an email, and where you're going to put a little more detail as to what it is that the patient needs, the basic subject, just like you would do for a regular email. Now, there are certain items that you can put in there that are pre-filled, or you can pre-fill this one by hand yourself in this area also. This is a medication refill request, so that's what we're going to put here. The next field is the Assign To field. In this field, this is basically who you're assigning this task to, who the message is going to go to. Now, normally, depending on what type of message it is, if you look in the source, our knowledge base, you'll be able to find who gets what types of messages, whether it goes to nursing staff, to the provider directly, or to a specific person for a specific task. For the sake of this training, we're going to send this message to me. And as you see, if you start to type my name, it's going to pop up my name under the options. Click on that. The next field is priority, and this tells you how important this message is to be taken care of, whether it needs to be done right away, immediately, or whether it's something that can wait for a little bit. Medication refills are normal priority because they're not urgent. The normal turnaround time frame will be about 24 business hours for a medication refill response. Now, there are other types of tasks that may be higher priority, a high or a stat priority. And if you look at the source again, the knowledge base, it will tell you what the different priority are for different types of messages. This notes section is where you're going to put the meat of your and body of your message. The actual message information is going to go there. Since this is a medication refill, I'm going to put that information in here. Remember to use the 5 W's when filling out your messages: who, what, when, where, why, and then also sometimes how. So I'm writing, this patient needs a refill for Otezla 30 milligram tablets sent to CVS Pharmacy on file. Patient's phone number is 555-555-5555, and the pharmacy's number is 999-999-9999. Notice that the medication here is spelled with a capital. Medications are very particular in their spelling and their nomenclature, so you need to make sure that you are copying from the RX history and copying that exactly and then pasting that into your message. to make sure that you get the exact medication that is needed and there's no mistakes there. You can also link to a visit. You can link to an order or add attachments to a message. Now, you'll do these in situations where maybe there's some information from a recent visit or there's an attachment that the provider or nurse needs to see that will be helpful in taking care of this task. Those are the basics for sending a message or a task over to the clinic. If you have any other questions, feel free to ask your trainer.